Hello, and welcome to the Thriving Black Minds podcast, bringing ADHD into focus in the Black community.
Hello, everyone. I'm Alvin King, your host this evening. Joining us is a clinical psychologist, a recent graduate of Howard University's clinical psychology program, where she specialized in children, adolescents, and family, an advocate for research, and currently leads a nationwide community health study on ADHD and sleep in the pediatric population, Dr. Brandy Walker. Hi, Brandy.
Hi, Alvin. How are you?
I'm fine. How are you?
I'm doing great.
So we're going to jump right into this, changing how we communicate about ADHD and mental health. Please explain, what is ADHD?
ADHD is attention deficit hyperactivity disorder. That diagnosis is normally ascribed to children at the age of 6 or 7, and it shows up in childhood. Sometimes the symptoms decrease, but most of the time it's carried on to adulthood. The child is basically seen by symptoms such as hyperactivity, challenges with attention, challenges with executive functioning, the ability to organize, the ability to plan, the ability to follow through with tasks, the ability to inhibit or prevent distractions from getting you completely off task. As an adult, those symptoms show up the same way. However, what happens is it's seen in your decision making, in your ability to manage finances, in the ability to maintain a job. We also see it in the way that people cope. Typically, if someone is not receiving medication but should, then we'll often see them maybe utilizing substances. And we call it self-medicating with substances. Sometimes if you have a coworker who drinks like 12 Mountain Dew a day, that could be a potential indicator. Drinking coffee throughout the day. So those are some of the symptoms.
Why do you think the Black community is not down with talking about mental health and ADHD issues?
One reason is because they don't believe that it exists. Another reason may be they don't want to be stigmatized by having a diagnosis. Another reason could be thinking you have it, but not wanting to get tested or not knowing how to get tested for that diagnosis. Generally, the African American community struggles with mental health and talking about it and owning it because we don't want something else added to our list of issues. A lot of times we're already dealing with financial problems or getting access to resources as it is. Being told that you have ADHD or believing it means, oh my gosh, there's something else wrong with me.
What are some of the common ADHD myths you've heard in the Black community?
So within a Black community, a lot of times we make the assumption because a child's father is not in the picture, they really don't have ADHD, they just have discipline problems. There is the idea that children just have learning problems or they have behavioral problems, not knowing that it's actually a full diagnosis. In that same vein, in a community that children have ADHD when they don't, when it's something else at play. So it goes both ways, but it's bi-directional.
What is an assessment and evaluation?
Particularly for children and adults, you can go to your doctor and ask to be assessed. When they do an assessment or a test, and they give you a series of questionnaires that you fill out, but then there also may be something like a test that you do on a computer, and it's measuring your ability to maintain attention, your ability to focus, be able to inhibit distractions. If you do really poorly on that test and you're also evidencing challenges in your social environment, relationships, because ADHD absolutely shows up in relationships as well, showing that there's impaired functioning in multiple areas of general or primary functioning is also an indicator. Normally, when someone does the assessment, they'll look at how you function in multiple environments, and they'll also look at, how you did on this computer test, and they kind of just take the sum of all that information. But what is key is that if you had it as a child, still have it as an adult, but you won't have it as an adult if you didn't have it as a kid.
You just educated me, Brandy. So how can parents know if they are receiving a proper assessment
One of the things they can do when they're talking to the school system is ask for a comprehensive assessment. A comprehensive assessment looks at what we were talking about, those key symptoms of ADHD, but it also looks at a child's functioning in terms of emotional functioning, how they're doing behaviorally, academically. A comprehensive assessment allows someone to compare what's happening in the school environment with what's happening in a home environment. So comprehensive just means they're looking at behavior, academic, social functioning, and they're looking at functioning across different environments to confirm the diagnosis. Or to identify if something else is the issue and it's not ADHD, it could just be anxiety, depression, trauma symptoms.
I'm not a parent, but based on what you said, now that my child has been diagnosed with ADHD, now what?
The options are potentially medication. So medication is recommended. It is not the only evidence-based course of treatment. And when we say evidence-based, we mean it's been tested across different populations, children or adults, and has proven to be effective. We look at medication as a really effective way, but not the only way. We actually recommend therapy, and if it's a severe case of ADHD, medication. Even moderate with like really significant or moderate problems, the medication is still effective. For someone who has a mild form of ADHD, or they have excellent coping skills or are open to learning coping skills, they may not need the medication, or the medication could be used starting out with therapy. Once they learn other coping strategies, maybe not need the medication. It just kind of depends on the child or the adult.
On the child and the severity of the ADHD. Am I saying that right?
You are absolutely correct.
Have you noticed that ADHD is under or over diagnosed in the Black population?
It happens both ways. So in terms of underdiagnosis, there are children who exhibit the symptoms and meet the criteria for the diagnosis. And particularly among children of color, they don't get diagnosed till 2 years later. So that means a 7-year-old who has classic ADHD symptoms won't get diagnosed until age 9. I mean, 2 years of not having resources, academically falling behind. A lot of times when children are in class and they're not staying up with the rest of the class, they get ridiculed or they get punished. But if you have a disability, you should get resources and accommodations. And without those resources and accommodations, you continue to fall behind. And so you get your diagnosis 2 years later and you're 2 years behind, not just academically, but also socially. The children with ADHD are the ones that have the most difficulty with making friends and keeping friends. And so when we're looking at children with ADHD, as they get older, the likelihood of dropping out is higher, 35% higher. The likelihood of engaging in some maladaptive way of coping, like promiscuity, alcohol, video gaming all day, overeating, undereating, all of those things are potential outcomes because a diagnosis has not been caught and treated. It's kind of like if you think about the Tuskegee experiment, right? And you have all of these African American males who have syphilis and they're not treated in a timely manner, even though we know that there is a treatment that works and would resolve the symptoms. So denying them treatment means that you're going to have a higher death rate. You're going to have a higher crime rate. You're going to have, extremely high medical issues and challenges. There's the social impact on the smaller scale for the individual, but also for the family and also for society. Talk about overdiagnosis when a teacher may think what they're seeing is ADHD, or a prescriber will prescribe medication for ADHD without doing testing or without doing a comprehensive assessment. So when that happens, we have African American boys and girls who get the diagnosis. That's not really the case. One example, while I was in my studies, I was testing a young man. He was like 6 years old for ADHD. Disruptive in class, not staying on task, getting into it with other kids. And the teacher was like, I think he has ADHD. They need to medicate this child. When I do my comprehensive assessment, I find out that this child's grandmother just died, and she was a primary caretaker in his life. His mom had moved in another gentleman into their household, and required her son to call him dad. This child was not getting sleep at night because of all of the mice he would see at night. So he thought he needed to stay up and protect his younger brother and sister. His sleep deprivation looked just like ADHD, but he didn't have ADHD. He just had a litany of other problems that could be resolved through therapy.
Would you have considered him being traumatized to a certain degree?
Not to the degree where I would say, oh my gosh, this young man has PTSD, but yeah, there are some trauma symptoms, there's some sleep deprivation, there's some unresolved grief. Then we have these new things happening with mom bringing somebody else into the household. Children need an outlet to say what they're feeling and be able to process their emotions and require accountability from their parents when things like that happen.
What can schools do to help? So are teachers educated regarding ADHD?
I think teachers receive some education. I'm not sure what the extent is. Part of public health mission, part of Howard University's mission, part of us being community focused in venues like this is to inform and help people be able to encounter that awareness. The African American experience is absolutely worthy of spending time understanding a person's plight. It absolutely speaks to their struggle, their symptoms, whether or not they have a diagnosis. A person may not have ADHD, but they could certainly have anxiety and depression, particularly in the context of COVID, sitting at home for hours, for days.
Right. Exactly. To the question, what can schools do to help Black children?
When they're recommending testing and assessment, they can also make sure that it's comprehensive, that they are dialoguing with parents and, if not parents, caretakers, to really understand fully what's going on with that child. They can utilize some of the things that they're taught, like tier 1 and tier 2 interventions, prior to making the assumption that a child has ADHD. It's being more diligent in understanding that child, first of all. Second, understanding children's learning styles. So African American children are kinetic learners, right? So they like hands-on, they have a lot of energy, they love utilizing a learning concept and being able to make it practical, real life. So if you want to teach math, you may talk about time does it take for me to get from this particular train stop to the next train stop if I got to stop and go to the store and buy 2 loaves of bread. Something like that is absolutely relatable and relevant. And it's a real problem that a child may have to deal with or face. If you can connect their real life experiences to their learning, a teacher can certainly see a tremendous intelligence there.
Are there 3 points that you'd like to share with our listeners?
Yes. Don't be afraid to understand what is going on for you. If you think you might have ADHD, if you think you might have anxiety, if you think you might have both, read up on it. You can certainly talk to your doctor or your prescriber about your concerns. You can make a list or note what you're experiencing. The other thing is look at your sleep quality. There is a strong relationship between these ADHD symptoms and sleep. This is more so for teachers or providers. Be okay with asking for a comprehensive assessment or doing a comprehensive assessment, of looking at the total picture of a person, of really trying to understand their story. The fascinating thing is that when someone thinks you're genuinely interested, they'll sit down and tell you what you want to know, including the family into as a source of information or as a unit to connect with resources. When we consider the diagnosis of ADHD, we neglect to think of it as an impact in the family system, but it tremendously impacts the whole family system. We talk about brothers and sisters, mom and dad, because of the way the diagnosis shows up. The other thing is that ADHD has tremendous heritability. So we're talking at least one of the parents has a 40% chance of having it, whether they were diagnosed or not. The family unit as a whole should be connected with resources, not just the individual. Finding someone who is familiar with you. It could certainly be someone of the same color. It could be someone who's not of the same color, but someone who is willing to understand that there are differences amongst people from different backgrounds. And that person demonstrating a willingness to understand your unique experience. The idea of health disparities is very real. We've seen it in COVID. We see it all the time. And someone who acknowledges that they are there and can see them can be more diligent about services that are more individualized to the person, particularly a person of color.
Thank you for being here today. We really appreciate it. And everything you said is very informative.
Thank you. Thank you for having me. I appreciate it.
Bye-bye.
You've been listening to the Thriving Black Minds podcast. Follow us on Facebook and Instagram at Thriving Black Minds and Twitter at ADHD Black Minds.